Thank you for joining us. As you know, the impacts of COVID-19 have been felt by everyone, but our small businesses have been hit the hardest by this pandemic. To ease the burden, we at the City of Memphis have created 2 microloan programs intended to assist Memphis businesses experiencing hardships during this pandemic. Along with an assistance grant program being developed by the Economic Development and Growth Engine, EDGE, of Memphis and Shelby County, this programming is intended to serve a wide range of businesses with the assistance of working capital like rent, payroll, and vendor payments. The first city program is the city's Division of Housing and Community Development and the city's Office of Business and Diversity Compliance. They are partnering on the Small Business Resiliency, SBR, Loan Fund, which will offer loans from $5,000 to $35,000 and will delay repayment for 90 days. There are 3 criteria. Number 1, first, applicants must show proof of being denied by the United States Small Business Administration or an SBA lender. Number 2, the business must be located within a distressed community in Memphis. And number 3, it must be you must have been in business for at least 3 years, and you must be certified with the city's Office of Business Diversity and Compliance. The funds for this program are from the United States Department of Housing and Urban Development Community Development Block Grant Program. The second city program is the Economic Hardship Emergency, EHE, Loan Fund, which will offer loans from $2,000 to $5,000, and there is no interest for 6 months. The criteria for that loan program are that businesses and their owners must be located within the city of Memphis, have less than $1 million in annual revenue, be in business for at least 3 years, and be certified by the OBDC in city government. The Joint City-County program is at EDGE, and the EDGE grant program is called the Neighborhood Emergency Economic Development, NEED, N-E-E-D, and it is subject to approval from the EDGE Board of Directors, which will meet electronically this Wednesday. The NEED program would offer between $5,000 and $10,000 to businesses that remain open with a 25% or greater reduction in revenue, and a plan for 90 days of continuous future operation, and $5,000 for businesses that are temporarily closed due to the pandemic, but have a plan for reopening within 90 days and staying open for an additional 90 days. The criteria for this NEED program are that the recipients must be located in the new market tax credit qualified census tracts in the city, or in the county really, have been opened before March 1, 2019, and have revenue of less than $1 million. For this NEED program, you do not have to be SWMBE certified. With all these new programs, we're hoping to help small businesses to bridge the gap as we work to get through this. Now, for more information on this, you can call the OBDC at 636-9300 or email the loan administrator, Jerry Brock, at Jerry, Jerry, .Brack, BRACK, at memphistn.gov. Applications will open Tuesday for the EHE Loan Fund and by early May for the SBR Fund. There are no fees to apply. For more information about the NEED or the EDGE program, please call 341-2110. 341-2110. Now we'll hear from Dr. Householder.
Thank you, Mayor Strickland. Good afternoon, everyone. I'm going to give brief updates today and give some specific updates on nursing homes that we're working with, and then I'm going to turn it over to Director Sweat from the Memphis Fire Department to give an update from the fire department perspective. To date, we've tested over 13,000 people in Shelby County. We still have approximately a 9% positivity rate and a 90% negativity rate. As of this morning, we had 26 deaths reported, but prior to coming to the press conference, I was given notice of 2 additional deaths, so we're now up to 28 deaths in Shelby County. As looking at our cumulative number of cases, we increased 53 cases in a 24-hour period, and while that is still an increased number, we are seeing that level of increase declining. Typically across the world, we've seen doubling rates about every 5 to 7 days. Initially here in Shelby County, we were doubling our rate around 8 days, and now we've pushed that out to doubling in 10 days. The importance of that is that we know social distancing is working, and it's reducing the transmission that we have from one person to another, so that's positive findings. If we look at ages, we still have the majority of our cases amongst people 21 to 60, and again, we're seeing increasing numbers in seniors, but primarily our cases are amongst young people. And if we look at sex distribution, which we've been reporting on fairly regularly, over 52% are amongst women, and 42% of our cases are amongst men. If we look at race and ethnicity, at this point we have about 45% of our cases have been entered into the system, and still about 71% of individuals impacted are individuals that identify as African American, and 23% Caucasian, and we have 5% that are identified as Latino or Hispanic of any race. A few key things that I wanted to give updates on have to do with the nursing home outbreaks that we've been working. As we said previously, we anticipate over time that you will see many clusters or small outbreaks that really have to do with places of employment or social settings, and one of the most critical places is in nursing home facilities or assisted living. We continue to work with Carriage Court. The update that we have relative to Carriage Court is they've experienced an additional death, which brings 3 deaths associated with that particular facility. We're also working with the village at Germantown. Currently they have 7 positive cases, 5 which are residents and 2 that are staff, and we're continuing to work with a Parkway facility. They also have 7 positive, 5 amongst residents and 2 amongst staff. And when there's a nursing home facility or any cluster, what typically will happen is the Shelby County Health Department, along with the state health department, works with that facility to identify, particularly if there are areas where they can improve infection control, if there are ways that they can cohort their patients into an area to separate those who are infectious from those who are not, and to assure that they have adequate PPE. We know nationally there's challenges in getting PPE, so for nursing home facilities specifically, part of our role is to assist them in getting that appropriate PPE, and we'll continue to work with those facilities and the state health department to address those particular items. So I'm going to turn it over to Director Sweat to give updates on what's happening with the Memphis Fire Department.
Good afternoon. I'm happy to speak to you today on behalf of the Memphis Fire Department and as well as all the other first responders in our community. Just so you know, in Shelby County, between fire and police, we have approximately 6,500 first responders in the community. They're out there on the front line, and just to be honest with you, I couldn't be more proud to be a part of that group. They're literally out there on the front lines, and we knew when we signed up for this job that we would be risking our lives. Many of us, this is my 28 years, I've never experienced anything like this, and this is something new for us in the first responder field as far as dealing with a pandemic of this nature. And I just want you as a community to know that you are well represented, you're well protected on the front lines, And the firefighters, the police officers, the EMTs, the paramedics, they're showing up to work every day just like they always do, and you're well taken care of in the community. I'm also proud to be a part of the Joint Task Force. The City of Memphis Office of Emergency Management falls under my area of responsibility, and we've been working closely with the task force on the task force priorities. Number one priority for us as first responders is to make sure that we all have adequate PPE and we can protect ourselves while we're out there protecting the community. So that's my number one priority. That's one of the number one priorities of the task force, is to make sure that we have not only adequate supply on hand now, but that we continue to have that inventory moving into our community so that all of the first responders can be protected. And second, and I haven't asked today, we have a safer at home order, and if you want to help your first responders to be safe, you can stay home. Staying at home is the number one way you can help us to not be impacted even more than we already have been by the virus. In addition, we're also working with the task force on testing. The Memphis Fire Department has been a partner with UT at the Tiger Lane testing site, and then later this week we'll be rolling out doing some testing in some of the underserved communities. So more will be coming out on that later this week. And the other priorities of the task force are predicting the curve and preparing to respond. We've also we've been working very diligently on an EMS surge center over at the Pipkin building, and that's just in place so that when we do experience the surge, that we will be able to handle offload delays and be able to get back out into the community faster and can serve you better. While there have been a number of first responders in the area who have been directly impacted by the COVID pandemic, I just want to assure you once again that your local fire, EMS, and police departments continue to provide adequate public safety services to the community. Just a few statistics about the MPD has experienced 21 positive cases to their commissioned police officers and 6 civilian employees. Shelby County Sheriff's Office, 15 positive cases, and between those, almost 250 have been quarantined over the past few weeks, and a limited number of positives and quarantined in the other municipalities throughout the community. As far as the Memphis Fire Department, we've had 19 positive cases. 7 of those cases have recovered and returned to work, and we've had around 250 employees quarantined over the past few weeks. Currently, we have 42 people still in quarantine, and as you know, with our recruit class was impacted with 2 positive cases in our out of our class at the training center, and they will be reporting back to work this week, and hopefully we'll be able to get them out on the streets pretty soon. As far as the other municipalities, they've no reported positive cases, but we have had a limited number of quarantines in our other municipal fire departments throughout the community. Once again, it's my pleasure to serve you, the citizens of Memphis, as your fire chief. And like I said, I'm very proud of the men and women, not only of the other municipal fire departments, but especially the Memphis Fire Department, who continue to answer the call to service every day. Thank you. And at this time, we'll be taking questions.
April Thompson with WREG.
Yes, I have, can you hear me?
Yes, go ahead.
Can you hear me?
Yes, go right ahead.
Okay. I have a question for the mayor. Can you talk about using this platform Zoom, because there are a lot of issues surrounding security of Zoom. And then I would like someone to address the antibody test. What is the timeline and the large scale for testing, and who is sourcing them?
When you're talking about your Zoom concerns, are you talking about for this press conference that we have?
Yes, using Zoom overall, there have been a lot of security issues with hacking and just the use of Zoom by the city.
Of all the concerns we have during this pandemic, somebody hacking into this press conference is probably not on my top 100. But we've heard your concern, and communications will reach out to you after this press conference. And with respect to the testing, I'll turn over to Dr. Householder.
In regards to antibody testing, much of the newer tests are still in development or in testing across the United States. We are looking heavily towards the state health department to give us guidance on what's the most appropriate test at a given time. As a conversation that I had over the weekend with the state health department, that the test we're currently using is the most appropriate to use at the current time. So while I anticipate in the future the antibody test would be available, I can't promise that that's going to be available anytime soon here in Shelby County.
Sam Hardiman with the Commercial Appeal.
My question is for the mayor, and I'd like to follow up. Mayor, where would the second testing facility, not second testing, second overflow hospital facility be?
Well, a week ago, I was hoping that we'd announce it a week ago, and I've been told, I can say?
Yeah.
All right, it's at your old stomping grounds, the Commercial Appeal office building on Union.
Sam, your follow-up.
And then my follow-up is, how long is it going to take both the Gateway Shopping Center and the old CA building to get online?
They will work immediately. As I understand, it takes 2 to 3 weeks to build it out. And the Commercial Appeal site will actually be the primary site, even though the work has already begun on Jackson. And the reason the Commercial Appeal will be primary is because it's closer to the medical center.
Bradley Broders with Local Memphis 24.
Good afternoon, everyone. I just wanted to ask Mayor Strickland a question and then a follow-up question for Director Haushalter. Mayor, do you have any goals or thoughts of how many small businesses might apply, and just your hope of the positive impact this will have on small businesses, especially those who may be rejected by the federal SBA level? And then my follow-up question to Dr. Haushalter is if there's any additional information moving forward in terms of the investigations at the assisted living facilities and the work moving forward with this. Thank you.
I don't have any estimate on numbers, but in general, the federal government through the SBA has so many more resources, so much more money than we do on the local level to help more businesses, and I have no doubt that they will help more businesses in Memphis and Shelby County than local government can. This is just to fill that gap, if we can, of those businesses who've been turned down for whatever reason from the SBA program. We know businesses firsthand. I know business owners firsthand who've all their life savings and investment is in a business that's teetering right now. We know thousands of people have lost their jobs, so if we can fill that gap just a little bit for a short amount of time to allow them to make payroll or pay some bills to survive this pandemic, we wanted to do all we could to do that, and that's what our goal was.
Kendall. Oh, I'm sorry.
There was a second part, I think.
And I hate to ask, but if you would repeat your question, because you broke up at the very end of the question.
No problem, Dr. Haushalter. I was just wondering if you could expand on any additional information regarding the assisted living facilities investigation moving forward. We're now at 3 different facilities in Shelby County. At this rate, do you anticipate there may be positive cases at other such facilities?
Yeah, we do anticipate that there are likely to be small clusters or many outbreaks in a variety of settings, and nursing homes is one of those. You have to keep in mind that employees who come to those sites are essential workers, and they're exposed throughout their day, both in the workplace and potentially in the community. So our goals currently are, when there is an outbreak, to focus with that specific institution on addressing any of the key issues they may have, whether it's infection control, whether it's detecting individuals who may be sick, whether it's testing and so on, but then also working with nursing homes more broadly. We have a small subcommittee that meets at least weekly with a variety of nursing homes, and particularly to address using PPE throughout the day to reduce transmission and prevent additional outbreaks. We'll continue to give updates on the 3 outbreaks that we're working, but again, I wouldn't be surprised if we don't experience more in the near future.
Kendall Downing, WMC TV.
Hey, everybody. My question, there's 2. As usual, I have a lot of questions, but I was just going to ask, I know Director Haushalter, you talked a little bit about the nursing homes, but can you talk about how you focus on a nursing home investigation and how focusing on that is different than investigating, other cases. Do you look at a nursing home case different as if you look at an outbreak in a workplace? And then also, I'm interested in learning more about the testing blitz. And then a question for the mayor after. I know we got some video last week at Lowe's at the Garden Center, which was overflowing with people buying plants and things to put in their flower beds. Have you all seen these images, and where do you kind of draw the line there? So those are my questions.
So I'll start with responding about the contact investigations, and I may turn it over to Chief Sweat to talk about the blitz because her team's very involved in what's happening later this week. A contact investigation always starts with the individual case. So if you're dealing with one individual alone, clearly you're looking at their family, their workplace, and so on. But when you have what are called clusters, particularly in vulnerable populations or in vulnerable settings, we have a strike team that goes out. So it's not one investigator, it's a team of investigators. And we look at what are the contributing factors to transmission, what are infection control practices, what is the history, whether or not there were potentially misdiagnoses, and the whole team looks at that and then makes recommendations that are at the individual level. So for individual employees, we sometimes will make policy recommendations as well as infection control recommendations. And I would say if you look at vulnerable settings, particularly for COVID, you're looking at any healthcare setting, any setting that has seniors in it, so that could be a high-rise, it could be a extended care, assisted living, or nursing home facility. But we also are looking at jails and making sure that anyone that is detained or incarcerated in a Shelby County facility is protected. So you would approach those vulnerable settings with a strike team with a significant more emphasis on infection control and policies that need to be put in place. So I'm going to turn it over if you want to talk about the blitz for this Thursday, Friday.
Yes, the blitz coming on Thursday and Friday. So you've probably seen us out in the community doing smoke alarm blitzes in the past, and that's kind of where we go door to door, knocking and checking on people and seeing if you have a need that we can help with. So this is going to be similar. It's a similar concept. We're going to start piloting on Thursday in a high-rise downtown on Bill Street, and it's just because it's a building we're familiar with. We'll be making contacts with residents on Thursday, setting up appointments for Friday to be tested, and we'll be working with the safety net partners to get that done out in the community. So hopefully when this pilot will, I'm confident it's going to go well, and we'll be able to expand this and to be able to reach more people in the community that don't have access to testing currently.
With respect to your question, I have not seen those photos, but I was talking to a mayor of a sister city here locally just this morning after our task force meeting about this very issue and about the very store you mentioned, Lowe's. We are looking at that. We have to take into account several things. First of all, whatever we think we need to restrict, we really need to clear it through our medical task force. I told you from the very beginning that science and medicine will guide our decisions. So they've done the modeling now, and they'll help guide us. And then we also want all the cities in Shelby County to be on the same page as much as possible. And then lastly, we have to worry about enforcement, because we can make a lot of statements and restrictions, but we have to then enforce it. Our code enforcement officers, as you know, have gone to over 200 businesses now under the current order and gotten in large part compliance. Memphis Police Department has made dozens of calls too. We're trying to keep the police out of it and just handle it through code enforcement. And then the health department has made several calls too. But we are actively looking at that, at least our office is, to make to prepare for discussions with the doctors and get their advice and our sister cities in Shelby County.
Bill Dries with the Daily Memphian.
Yes, Mayor. In talking about your loan program for small businesses, was this something that you anticipated doing, or are you hearing from a lot of businesses who are not able to get the funding they feel they need from the small business administration loans that the feds have outlined?
I think it's a little of both. I think from the get-go, we said, what can we do to help small businesses in particular with the limited funds that we have? But then I think the criteria was adjusted in the feedback that we were getting from so many businesses who can't get through to the SBA or to an SBA lender or have been just outright denied. So I think it's a little of both of your question. Both parts of that question are true.
Jackie Massey with Fox 13 Memphis.
I had a quick question about the Gateway Shopping Center and just the process. Like, how is that going with opening that up? And when it's open, do other businesses in that shopping center, are they going to be closed? Like, how's that going to affect the other businesses? I'm hearing that a lot of people are concerned that those businesses might be shut down, or those businesses might even lose business because it's so close to a facility that'll be holding COVID-19 patients. And just people in the community just seem pretty concerned about that. How do you plan on just keeping it contained to that building and making sure that other businesses aren't affected by that? And then my other question is about some other governors, like governors in Texas and other states with a larger population, are already talking about reopening businesses and stuff like that. I know it's pretty early on, but are you guys looking at a plan in place, and how would that plan work?
Let me handle the second part first. And I believe what I'm about to say is not unique to Memphis or the state. There's certain criteria, I think, that most reasoned people on this topic believe that need to be used to determine whether you can reopen business or even slowly reopen business. Number one is the number of positive cases that you have are declining. Number two, that you have the availability of widespread testing, much more than we had a month ago for sure, and probably more than you have now. Number three, a dramatic increase in the ability to contact trace, isolate, and quarantine. The health department has already dramatically increased their capacity, and I think I feel confident that they'll be able to do that. All of those things are to ensure that our hospitals are not overrun with cases, which is what we're concerned with now. So if you're going to loosen the faucet, it's almost like a faucet. We've tightened the faucet slowly, and if you're going to slowly let it go, you need to have the cases trending in the right direction, a lot of testing available. Like for instance, I always use South Korea as an example. What South Korea did was able to use testing as sort of to box this virus in with testing, isolation, contact tracing, and quarantine, to box it in. We weren't given that luxury in the United States because we didn't have enough tests. Hopefully we will have that in relatively short order. And so I can't quantitative what percent the cases should decrease or how many tests you need available. I think over the next 6 to 8 weeks, we'll learn more about that. But I think that's just my opinion. With respect to the Jackson Avenue Field Hospital, the state selected that site with input from the locals here. They have contracted for it to be renovated. I believe that's already started. And they've appointed 3 professionals from UT Memphis to be the chief operating officer, chief financial officer, chief nursing officer to run that facility, and they have experience in that. So because of their profession, because they know what they're doing, I do not think any nearby businesses need to be worried about transacting business. But when the time comes, we can certainly put those businesses in contact with the leadership of that field hospital so that they do get the information and maybe feel more comfortable about it. Did you have anything to add?
Katie Reardon with WKNO. Next and final caller, Jacob Steimer with the Memphis Business Journal.
Yeah, there's the two new loan programs you announced today,
Jacob, you cut off.
Jacob, I'm sorry, can you repeat that, please?
the two new loan programs announced today, those those are not forgivable, correct? Those are just the no interest for a while. Is that the benefit?
That's correct. There's no interest. They don't have to make any payments for some period of time. They are not forgivable, at least at this time.
And then so as far as you know, Gateway Shopping Center is still moving forward as a location.
Yes, sir.
Okay. Thank you.
We've got Katie back for her final question.
Hey, can you hear me?
Yes, go ahead, Katie.
Okay, thanks so much. My question's for Director Sweat. Thanks so much for being here today. I had a couple questions for you in terms of protective equipment for our first responders. When you say adequate, what does that mean? Does that mean that our first responders are receiving a mask a day? Because we've gotten some reports that they're being asked to stretch it as far as they can. And then my second question is, when you talked about our first responders within their respective departments being quarantined, what does that mean for your ability to staff? If this many people are in quarantine, does that mean a lot of overtime for people? Is this stretching MPD's fire department staff?
Okay, good question. So first of all, we began planning for this even before it became a local issue as far as the Memphis Fire Department. Okay. So we were able to procure PPE for our firefighters, especially masks. And so we've been able to make sure that they're all protected when they go out on certain, especially on calls that may be COVID related. Now, you've probably heard, we did ask them to stretch the use of their masks. The masks can be used multiple times unless they become contaminated. And so this is not just something for the Memphis Fire Department. All the community has been asked to do so, to stretch the supply of masks out. While we do have an adequate supply for now, the supply chain has been slow, but we finally have some movement here in the Mid-South. And we had an order come in late last week of surgical masks. And my understanding is we have a couple of fairly large orders coming in this week to the Joint Task Force to be available to all of our first responders in the community. So as far as that, we wanted to just make sure that what we have, we take good care of it and make it last as long as possible, because as you know, PPE has been an issue not just locally but throughout the United States. And in response to your second question, as far as the quarantine numbers, of all of the fire departments in the area, the Memphis Fire Department has had the largest number of those in quarantine. The city, we canceled vacations early on, so we've been able to staff with personnel and regular overtime, so we have not had any reduced staffing levels at all in the community. And as a matter of fact, most firefighters are really stepping up and coming to work if at all possible. And not only that, I've even had retirees call me that would be willing to come back to work if we had need of that. So this is what first responders are here in the community for. This is what we train for. And so they're really stepping up to the plate and coming to work now for this event.
This concludes our briefing. Any final statements? All right, thank you, everyone. We will see you next time. Please stay healthy.